Hi, my name is Heather, and this is my informative speech. How many of you out there have actually thought of diet and exercise as a way to prevent or control a disease? There are several different diseases out there that can actually be prevented and controlled with diet and exercise. The disease that I'm going to be talking about today is diabetes mellitus, more commonly known as just diabetes. There are millions of Americans today that are affected by this disease or know somebody that is affected by this disease. Diabetes is actually a disease that is caused by your pancreas. Your pancreas secretes a hormone called insulin, which helps break down those blood sugars in your bloodstream, helps them get absorbed into the body cells so that they can be used for energy and fuel for the body. And if that blood sugar is not allowed to pass into those cells, it remains in the bloodstream. And for long periods of time, that can cause severe health problems. There are two different types of diabetes. The first one is type 1 diabetes. This is probably the most serious form. It was always formerly known as juvenile diabetes or insulin dependent. And by the name, I'm sure you can guess that insulin dependent does mean that the insulin needs to come from an outside source because the pancreas no longer makes this insulin needed for the body. There's actually no prevention for this type of diabetes. You can actually probably prolong not getting on insulin by maybe oral medications. There is no known cure. Type 2 is also known as non-insulin dependent. This is the most controllable form of diabetes that there is. With this one, the body just doesn't make enough insulin for the body. It does make some, but not enough to let the blood sugar flow into the body. This one can be controlled with diet and exercise and or oral medications. There's several out there that I've heard of, but this one, you do not need to have insulin injections. They have come up with, for several years now, it's actually a synthetic insulin, which is made from, I've heard, from pigs, from animals. They've actually got an insulin out there that is made from the saliva of the bearded dragon. Ways that they usually often detect diabetes is they will monitor your finger sticks, which we call finger stick blood sugars, which you take a lancet and you normally have to poke your finger and get a drop of blood, and then this glucometer will tell you the sugar in your blood. Normal is, for an adult, is between 80 and 110. There is some research out there trying to more personalize an individual's blood sugars. I know where I work, we can have somebody that's 200 finger stick, which is normal for them. And if they drop below 200, then they start feeling the signs and symptoms, which for hypoglycemia, symptoms could be shakiness, mental changes, sweating. For hyperglycemia, which is an increase in your sugar in your blood, you can have just a mental change. The very first onset of diabetes, you should look for like excessive urination. If you have to just go to the bathroom all the time, which leads to you being constantly thirsty, which is a sign that your kidneys are trying to rid your body of the excess glucose, which your kidneys filter it out, and your intake of water somehow tries to balance the water in your body, which only in turn harms your kidneys. Your kidneys can shut down. You can have renal failure is what they call kidney shutdown, and the only known cure for that is a kidney transplant. Most people with diabetes that have left it uncontrolled or unmanaged for several years usually end up on dialysis. And dialysis is a machine you have to get hooked up to actually rid your body of that excess fluid and that extra sugar because your kidneys are not filtering the waste from your body. There are several different signs, including weight loss or the potential to not gain weight. You could be hungry and not gain weight, which I'm sure many of us would like, but in this case, it's not good because your body is actually in turn turning on your muscles and starting to break down your muscles to use for fuel for the body, which results in loss of muscle tissue. You're more tired, you're more droopy. There are several long-term complications by leaving diabetes untreated. It can lead to eye problems. One, cataracts, which is a clouding of your lens in your eye. It can lead to kidney failure. It can lead to diabetic neuropathy, which is the loss of feeling and nerves in your extremities, which is why I say limb loss earlier, because due to not having any feeling in especially the lower extremities, somebody can have an infection and not feel it, not know it, and it tends to get to the point where it becomes gangrene, and that area generally has to be cut off or cut out, which is why you see several people who have not been able to control their diabetes with maybe only one leg or one foot. So that's why it's very important to watch for the signs and symptoms. Excessive thirst, excessive urination are the key signs. So if you are feeling any of this, I urge you to get to the doctor and get tested. Otherwise, this will be your lifelong pal. You will have to carry these around and give yourself daily injections. So diet and exercise, I know it doesn't always sound like a good idea, but diet and exercise can and has prevented diseases. And it can and will prevent diabetes if you monitor it right. Thank you.